Hello everyone, Namaste, Namaskar, and welcome to Apollo 24/7's Health Hour. Every week I bring you an expert from Apollo Hospitals, and this week I'm getting you a wonderful senior consultant dermatology, Dr. Anshul Warman, to the show. She's going to join us very soon, and with her 20 years of experience, she's going to give us some wonderful tips to how to get rid of acne. Pimples के बारे में हम बात करने वाले. And for the information of all the viewers, we're going to talk in English, a bit of Telugu here and there. నేను కొంచెం మీ అందరి కోసం సమ్ అప్ చేసి తెలుగులో డాక్టర్ చెప్పిన పాయింట్స్ అన్నిటిని మీకోసం తెలుగులోకి మళ్ళీ చెప్పగలను. And also doctor speaks Gujarati, so we will also try and get some Gujarati as well. So type in your questions. You can find us, see us on YouTube. You can meet us on Facebook pages, or you can also see us on other social media pages. But if you want your query to be answered, please type your question on the YouTube chat so that I can take this up with Dr. Anshul Warman, who's going to join us very shortly. And also on this show, you'll be able to win prizes. There's a health quiz coming up towards the end of the show. And also there are discount coupons to be given away. Be with us towards the end and collect all the coupons and get the benefits. Before that, let me also remind you that downloading Apollo 24/7 is literally having the entire Apollo hospitals in your palm. So go ahead, download Apollo 24/7. चलिए आज का टॉपिक शुरू करते हैं. हाउ टू गेट रिड ऑफ एक्ने, पिंपल्स के बारे में बात करते हैं. आज हमारे स्पेशलिस्ट है डॉक्टर अंशुल वर्मन, सीनियर कंसल्टेंट डर्मेटोलॉजी फ्रॉम अपोलो हॉस्पिटल्स इंटरनेशनल अहमदाबाद, एंड हर एक्सपीरियंस is more than 20 years. Let me just talk about her experience. She's a professional membership. She has professional memberships in Indian Association of Dermatologists, Venerologists, and Lephrologists. And she's also a member in Gujarat Medical Council and a lot of awards. Best Dermatologist Award from Ahmedabad, Times of India survey में Dr. Saiba Best Dermatologist रह चुकी है. And also she has the Best Doctor Award from Apollo Hospitals International Limited Ahmedabad as well. Good morning there, Doctor. Dr. Anshul's joined us. Good morning.
Good morning.
How have you been, ma'am?
Yeah, I'm fine. Thank you. How are you?
All well, ma'am. Thank you. You're glowing. In fact, you will not believe. I was reading your resume. I was expecting, while I was reading your profile, I was expecting 20 years of experience. So I was expecting a different image, and I see somebody beautiful on the screen. So good. So, let me ask you, how do you keep yourself acne free?
Well, acne has always been part of my life, like most of us, as we would know, even your teenage, even in adult acne. Now, we faced a lot of mask acne. So during the COVID periods, I had a lot of
Right.
mask acne. So it is a part and parcel of your life. It comes and goes. You just have to manage it wonderfully. We'll come to know with the secret tips now.
Okay, so you too have gone through acne, is what I understand. Acne doesn't spare dermatologists as well. Actors, I think, as an actor, I understand what kind of suffering it was. It wasn't just the teenage acne; it continued almost 30 years of my life, and I had to struggle with repeated acne. So people think that now I am clear, there's nothing there to worry about. And people think that आपका क्या है मैम, आपके फेस पे पिंपल्स है ही नहीं, आप तो कुछ भी बोल सकते हैं. No, I've gone through this. I know what kind of trouble it is. So
Your
let me
makeup
quickly.
acne would also, come up.
Oh
Actresses,
really?
when using a lot of makeup, they clog the pores, and then you get a lot of acne breakouts due to that. So good that
Right,
you were
right.
scared of that.
So correct. It's not just actors as a professional actors then, because a lot of people right now are using makeup. That has
Yes.
become a part of parcel. All the software, bolo aap, kuch bhi bolo, something that makeup has become a part and parcel of life. So it's not just one gender. I see a lot of other genders complaining about acne too. So let's understand the common causes. So first and foremost, what are the basic concerns around acne that you see in your clinic, and what are the common causes that you find?
See, acne, pimples, breakouts, whatever you understand. Basically, whenever our skin, mainly wherever there are a lot of oil glands or sebaceous glands that we call, are concentrated, there you get such inflammation. So that inflammation has 3 to 4 components into it. One is the active or overactive sebaceous gland, that is the oil secretion is overactive. So commonly we see
Yes.
in pubertal age groups, and that is the time when your journey with acne begins.
Yes, yes,
So
puberty is the time. Huh.
so there will be sebaceous hyperplasia, that is the oil glands are overactive. Then there is dead cells clogging the pores of the duct of the sebaceous gland. So it is blocked.
G.
So you feel those blackheads, whiteheads coming up inside your skin. You feel grainy. You feel breakouts. Then there can be secondary infection of some bacteria. The commonest is Propionobacter, that is causing acne. So then there can be small pinpoint pustules forming it. And then there is rebound inflammation that your skin might overreact with. So there is cystic acne, there is a lot of redness, there is a lot of pain. That is all the inflammation which is happening in the skin. So
Right, right,
acne
right.
has a different morphology, and what we see is mainly, what people are concerned is mainly for the face, but similar changes can be bothering even on other body areas also. So that can be happening on the chest, on the back, on the upper shoulders, wherever we have sebaceous gland overactivity.
Right. So, to understand this is a very complex thing, but we all go through so much of stress. I see, because I have a 19-year-old and also a 25-year-old at home. So both of them are worried about their skin. Even the slightest of the breakout, they're worried about it. So I see that the stress is too much. So though everybody goes through at that point of time, I now am relaxed, but then I can understand the concern that a 19-year-old and a 25-year-old have. So across the age
Filters,
groups, as
yeah.
is it different
Carry on,
from the
carry on.
age group? Yeah, yeah. No,
Yes, it
ma'am.
is.
How does it
Uh,
present differently in each age group?
See, the acne presentation is different in different age groups, but definitely जो तकलीफ हमें acne से हो रही है, that is also different in different age groups, I must say. So filters will not change your acne breakouts. It would, change your complexion. It will change your, the skin tone when you are taking a selfie or using these filters in the social media. But they can't really hide your pimples. So that's definitely stressful. That's
So let
how
me
young
add
people
some.
look at it.
लेट
Yeah.
मी ऐड कि ये जो डिजिटल एज में हम अभी है, जो हम गुजर रहे हैं डिजिटल सोशल मीडिया के प्रेशर से, यहाँ पर हमें तो फिल्टर्स की वजह से क्लियर स्किन की ज़रूरत है. So it also gives us some kind of stress where we want clear skin or pimple free skin, which is normal at a certain age. But are these stress factors stressing more? Will stress or psychological factors cause more acne?
Yes. Any type of stress, commonly exam stress है या कोई भी तरह का you are undergoing a lot of work pressure. तो सब तरह का stress जो है, if you are acne prone skin, then it will definitely break out. यानी stress की वजह से acne बढ़ते हैं. So even if you do not have acne, they can flare up. Even if you have milder form of acne, they can be, aggravated.
जी. सो स्ट्रेस की वजह से एक्ने एग्रीवेट होता है, पर स्ट्रेस की वजह से आता है क्या? विल दिस कम विद स्ट्रेस? कैन
Prolonged
स्ट्रेस
stress,
कॉज?
yes. अगर short bursts हैं stress के, so then our skin and our body is, adapting to it. But if it cannot adapt, or if it is being in that adaptive form for a prolonged time, maybe weeks, months, then yes, it can cause that.
So on the blanket we can say that stress is not the cause for acne, but it can aggravate. ठीक है. So
Absolutely.
that is one. But there's yet another thing कि मैंने बहुत सारा घी खा लिया तो मुझे एक्ने हो गया. तो बहुत ही गरम फूड्स बोलते हैं, हम हमारे लैंग्वेज में बोलते हैं वेड़ी जैसे पदार्थालू. सो गरम कुछ है तो अंदर से ये जो लाल लाल होते हैं वो निकल के आते हैं. So is it true that diet has a factor? Is it a factor in acne?
Absolutely. Diet has is a factor, and scientifically it has been proven. जो सब फूड्स हमारा शुगर लेवल्स बहुत जल्दी बढ़ाते हैं, यानी व्हाट वी कॉल इट एज हाई ग्लाइसीमिक इंडेक्स, वो सब चीज़ें कॉमनली जैसे डाइटरी प्रोडक्ट्स होता है या बहुत ज़्यादा प्रोसेस्ड फूड होता है, तो उन चीज़ों से हमारा स्किन का या जो सेबेशियस ग्लैंड्स का और केराटिनोसाइट जो स्किन के सेल्स हैं, उनका एक्टिविटी सब बढ़ जाता है. So definitely all high glycemic index containing diets will aggravate acne.
Right. So high glycemic or anything, high glycemic is simple carbohydrates, you mean to say? It's
Yes,
not just
simple
ghee or
carbohydrates.
cheese or butter, not just these, not just the fats, you mean to say.
Yes, not just the fats, but processed food and a lot of simple sugars that we have commonly in chocolates. That is why people say chocolate खाने से तो मुझे हर बार breakout होता है. So if you have been having a lot of chocolates repeatedly, it can cause a breakout. इसी तरह से बहुत ज़्यादा sugar containing cold drinks वगैरह जो रहता है, उनसे भी बढ़ता है. So fried food is definitely a lot of ghee and oil is causing it, but a lot of sugar food and dairy products in certain patients can flare up the acne.
Okay, so I accepted that yes, our lifestyle habits have a or food choices have a major impact on our skin. But also, are there any friendly foods that can get rid of acne or keep the skin clear? Or is there a thing that we can look out for food group that we can include in our diet?
When you ask me of food, I think of two things. One, what you eat, and one, what you apply on the face. Trust me, because we get people applying so many sorts of things on the face trying to get rid of acne, and then finally they
Yes.
seek expert advice and come to us. So,
So,
coming to your
my
question,
aunt who used to live with me for a very long time, who took care of me and my children, she used to keep applying the fruit that she used to eat. So वो बोलती है रिमाइंडर है कि तुम ये खाओ और ये लगाओ. तो पपाया खाते हैं और पपाया फेस पे लगाते थे, खीरा खाते थे और खीरा फेस पे लगाते थे. तो बोलते हैं जो चीज फेस पे लगाने का है वो खाने के लिए है. So it's a two what do you call double-edged thing. She always used
yes,
to tell this कि आपको ये बाहर से ही नहीं अंदर से भी काम करेगा, खाओ और लगाओ.
but that works only for fruits commonly, not
Of
with
course
the
मिर्ची तो
processed
नहीं कर
sugar.
सकती हूँ.
Anyways, coming to the
Yeah.
main question. So, the healthier or the helping diet which can improve your skin is a lot of hydration, first of all, water. बहुत सारा
Yes.
fluid intake helps, but at the same time, I tell my patients not a lot of fruit juices help. You know, if you're eating the full fruit along with the fiber and whenever possible along with the skin of the fruit, it is much better. So
Not the
they
juice.
go a long way. Yeah, eat the whole orange, and eat the whole apple with the skin, maybe after washing it properly. But then that always goes a long way in helping your skin.
जी,
And
जो आपने
then
हाइड्रेशन जो बोला है, इज इट ओनली विथ वाटर और डू यू थिंक इट कुड बी एनीथिंग लाइक छाछ ले सकते हैं या सूप्स हो सकते हैं, एनीथिंग?
anything healthy water based is fine. Yes, lemon juice,
So I
coconut water.
Yeah, I know people who keep adding. Of course, even I have gone through that kind of phase. Let me admit it. कि detox waters and acne and clear skin के बारे में इतना एकदम uproar था. So even I jumped into the bandwagon. I consumed bottles and bottles of water which had pudina, which has kira, which has ginger, and a lot of detox waters that I used to make. How good are these?
Yeah, they help definitely. But see, at the bottom line, you have to understand how your body works for it and how your metabolism helps in it. So, not one thing will work for everybody.
G. Gee, that's right. That's right. But basic hydration works for everybody, and that we should not forget. ठीक है, अभी जो ट्रीटमेंट्स के बारे में बात करेंगे थोड़ा. आने के हाउ डू आई स्टॉप देम, हाउ डू आई आने से पहले कैसे रोके, ये डाइट और लाइफस्टाइल एंड अदर स्ट्रेस फैक्टर्स के ऊपर है. बट आने के बाद ये पूछा कीजिए कि वी ऑल रन टू द ओवर द काउंटर मेडिकेशंस. कभी क्रीम लगाया, कभी वॉश किया, कुछ जेल लिया, कुछ ना कुछ ओवर द काउंटर फर्स्ट तो हम ट्राई ही करते हैं, especially in the younger days. What is your take on all these over the counter products?
home based over the counter products in the initial stages, or when your acne is more or less under control, and you just want to get rid of one or two breakouts, is fine. And then as a regular skincare, if it is working for you, is also acceptable. But if it is that bad stage of grade 3 grade 4 acne, wherein all the time you have more than 5 10 breakouts, there are pustules, they are painful ones, then it's not a good idea. Then it's better to seek treatment.
राइट सो ये जो हार्मोनल इश्यूज की वजह से थोड़े होते हैं, और आपने जैसे बोला है कि प्यूबर्टी में भी थोड़ा निकल जाता है, एंड दैट्स नॉर्मल. तो व्हाट डू आई अंडरस्टैंड एज नॉर्मल और रेगुलर, कि ये साइक्लिकल है, एंड दिस इज नॉट नॉर्मल, दिस इज बियॉन्ड आवर कंट्रोल एंड वी नीड सम काइंड ऑफ हेल्प. हाउ डू यू ग्रेड देम?
See, first of all, especially in pubertal age group, when we say it is physiological acne, that means it is part of your growing up and your teenage, years, wherein a few small blackheads, whiteheads, एक आधी इधर उधर लाल छोटा दाना या पिंपल जैसा आना is fine. And then what we understand is, if it settles also on its own, maybe in a week 10 days वो चला जाएगा, उसका कोई निशान नहीं रहेगा, उसका कोई मार्क नहीं रहेगा, कोई स्कार नहीं रहेगा. So that is physiological, यानी कि it's a part of your daily skin changes which is happening and it is repairing itself. But
जी.
if those blackheads commonly on the T zone that we see, young girls, young boys, वो बहुत सारा ऐसा forehead पे blackheads रहता है, पूरा shiny look रहता है, and it stays for months together, then you have to seek treatment. तो वो नॉर्मल नहीं है. इसी तरह जब वो धीरे धीरे उसमें बढ़ते बढ़ते उसमें इन्फेक्शन हो रहा है, उसमें पस आ रहा है, उसमें रेडनेस ज़्यादा आ रहा है, पूरा बैकग्राउंड स्किन भी रेड हो गया है, ना कि सिर्फ वो दाने, देन यू हैव टू सीक ट्रीटमेंट.
ओके, सो ये है जो आपने नोट किया होगा व्यूअर्स की, दीज आर द वंस व्हेन यू हैव टू गो एंड कंसल्ट अ डर्मेटोलॉजिस्ट. सही टाइम पे डर्मेटोलॉजिस्ट से मिलेंगे तो ट्रीटमेंट आसान हो जाएगा, इसका नेग्लेक्ट मत कीजिएगा. तो व्हाट आर द ट्रीटमेंट ऑप्शंस दैट आर अवेलेबल? व्हाट आर द वेज दैट यू ट्रीट डिफरेंट अप्रोच डिफरेंट काइंड्स ऑफ एक्ने, डॉक्टर अंशुल?
See, first of all, we have to understand what is causing acne in any patient that is coming to us. अगर यंग गर्ल आ रही है तो उसका क्या प्रॉब्लम है, अगर कोई प्रोफेशनल है, एज वी डिस्कस, कि मेकअप यूज़ कर रहे हैं तो क्या प्रॉब्लम है, अगर पीरियड्स रेगुलर नहीं है तो हार्मोनल बैकग्राउंड है, हार्मोनल डिस्टर्बेंस है, सो देन द अप्रोच वुड बी डिफरेंट. अगर मास्क एक्ने है, सो देन अगेन different approach. अगर adult acne है, that means after your 35 40s you get a lot of acne. So those adult acne, the whole cause and the treatment plan is completely different. So until your dermatologist understands and discusses with you the cause of your acne, the treatment would be incomplete. That is how I
Correct.
put it. You know.
No, and
Then
you're
comes the treatment.
absolutely right. It has to be the specialist, and it has to be the right kind of specialist. So it's not the salons or the beauticians who can decide, is what I believe. क्योंकि वहाँ
Absolutely.
पर काफ़ी सारे पील्स मिलते हैं, काफ़ी सारे एक्ने रिलेटेड प्रोडक्ट्स मिलते होंगे बाहर, बट आई हैव माई डाउट्स ऑन देम. अगर वो एग्रीवेट करते हैं या एलर्जी और क्रिएट करता है तो आउट ऑफ कंट्रोल हो जाता है. Right.
Exactly.
So,
Yes.
ma'am, I do have a lot of questions on YouTube which are coming in. First one, different types of acne के बारे में आप जैसे बात कर रहे थे. तो here's one question that I wanted to ask you about back acne. Naman Bansal जी पूछ रहे हैं, please discuss on back acne scarring. तो ये एक्ने आपने बोला है कि काफ़ी सारे जगहों पर प्रेजेंट हो सकता है, कि नॉट जस्ट ऑन द फेस बट ऑन द बैक और ऑन द बॉडी. सो बैकनी इज क्वाइट कॉमन.
Yes, back acne is very very common, and it is commoner in males. Yani teenage boys, office going, males, they have a lot of back acne. Especially nowadays, they don't like it when they're going in the gym or when they are going for swimming and all. And now there is a lot of trend in removing the hair also in males, especially the body, after they are gymming and all. So this back acne has to be first of all differentiated from folliculitis. That is, if you are removing your
ओके.
hair, तो फिर आपका वो हेयर फॉलिकल का इन्फ्लेमेशन हो रहा है या वो एक्ने है. वो चीज़ आपको आपके डॉक्टर से डिस्कस करनी रहेगी। आप प्रॉपर हिस्ट्री देंगे उनको कि किस तरह आप अपना हेयर रिमूव कर रहे हैं या आपका हाइजीन कैसा है। इफ यू आर यूजिंग अ लॉट ऑफ हॉट वाटर फॉर बाथ, दैट कॉजेज हॉट वाटर फॉलिकुलाइटिस। तो वो भी एक बैक एक्ने का एक डिफरेंशियल डायग्नोसिस हम बोलते हैं, वो हो सकता है। सो वंस वी नो दैट इट इज एक्ने ओनली, देन वी हैव टू अंडरस्टैंड व्हाट ग्रेड इट इज। या तो वो ग्रेड वन है, जैसे बारीक बारीक ब्लैक हेड्स जैसा है, डॉट्स पूरे एरिया में है, विच इज रफ टू टच एंड विच इज प्रिकी वेन एवर यू स्वेटिंग। और इट इज दोज पेप्युलर फॉर्म्स, रेडिश सारे हैं या पस्ट्यूल्स आ रहे हैं या बड़े बड़े सिस्ट में से स्कारिंग आ रहा है। So once we ascertain that, we have to plan an oral medication. कुछ ना कुछ आपका शुरुआत में एंटीबायोटिक रहेगा। उसके बाद जो ये सिबेशियस हाइपरप्लेजिया है, जो डेड सेल्स अक्यूमुलेट हो रहे हैं, उनका टर्नओवर नॉर्मलाइज करने के लिए एक मेडिसिन यूज होता है, आइसोट्रेटिनोइन। ज़रूरत पड़ती है तो ग्रेड 3 ऑनवर्ड्स हम वो भी देते हैं। फिर लगाने के जो क्रीम्स हैं, दैट हैज़ टू बी इंडिविजुअलाइज्ड। व्हाट इज़ योर कन्वीनियंट शेड्यूल फॉर अप्लाइंग creams, especially on the back? Do you have some help that can apply it for you on the back? Otherwise, I will prescribe and then you will just end up in keeping it on the table. You won't be able to apply on the whole back. So there are so many minor points which we consider, without which treatment will never be complete. Then
जी
उन्होंने पूछा है scarring के लिए, तो scarring में we will have to use some sort of a procedural help, that is either a chemical peel or some laser, depending on what the flare up is.
जी तो सीए वर्ल्ड ये रजिस्टर भी किया है इन्होंने अपना क्वेश्चन, एंड ऑल्सो उनका क्वेश्चन यहाँ पर लाइव पे भी मुझे दिख रहा है। इनका नाम है सूरज ठाकुर। माय एज इज 25। एक्ने इज नॉट स्टॉपिंग इवन नाउ। it doesn't come until it doesn't go until I take medicines, but once I stop these medicines, it comes again on my back, face, and on my head.
Yes. So that is a very common problem कि जब भी दवाई बंद कर रहे हैं, it is coming back. So we have to understand that there has to be something called a maintenance regime. Once we have
जी
taken care of your active inflammation, once your new acne, the rate of coming up of new acne is gone down, we want to maintain the skin. So you have to discuss your maintenance plan with your dermatologist. It is not that once you have responded to treatment, you stop going to your doctor, you stop your medications, then it might come back. So you have to go back to the doctor, discuss the next maintenance step down plan.
Wonderful. Thank you so much for that, ma'am. Here's a very, you've been pointing out to this question right from the beginning. The new age pandemic के बाद जो हमको मिल रहा है, विभोर कौशिक भी पूछ रहे हैं, hello doctor, how to prevent mask acne? Masks are difficult to be removed at workplace. Yes, all of us are going through these. And especially I also had gone through so much of mask acne. So it was very difficult in the beginning. What are your suggestions to deal with this?
Change your mask every day.
Of course.
Preferably, if you are having those, a lot of humid environment in the enclosed area of the mask, what I used to do is maybe you can wear a cloth mask inside and then your N95. That works for
Ah,
some people. For some people, what I suggest now is use a calamine based lotion, that's a zinc oxide lotion,
yes.
on the affected area. So it will not cause that humid environment in the skin, and it will prevent that bacterial colonization or the flare up which is happening. So these simple tips, and then remove the mask whenever possible and wash your face and then reapply. That also helps.
Great, thank you. Because this is again a larger section of population who are using mask, and then there's mask acne. And second thing that is related to mask, I don't see anybody is asking that question on the YouTube. So let me ask that. Existing जो acne के issue face करने वाले हैं, उनको अगर मास्क पहननी होती है तो काफ़ी सारी कठिनाइयाँ होती है। ऑलरेडी इन्फ्लेम्ड स्किन होता है, ऑलरेडी इचीनेस होता है, पस होता है, पेनफुल होता है, रेडनेस होता है, देन मास्क पहनना पड़ता है। उनकी काफ़ी सारी प्रॉब्लम होती है मैम। हाउ कैन वी एड्रेस दिस इश्यू?
यस, उसकी वजह से काफ़ी सारा पिगमेंटेशन भी हमने देखा है। कि आपके एक्ने जब हील हो रहे हैं, इट्स नॉट गेटिंग दैट ब्रीदिंग स्पेस, सो उसकी वजह से रिबाउंड या रेसिडुअल पिगमेंटेशन आता है, यानी स्पॉट्स और मार्क्स बहुत लंबे समय तक नहीं जाते हैं। यू नो
करेक्ट
सो
करेक्ट।
प्रिवेंट दैट अगेन, undergoing a proper treatment for your active acne. जो आपका acne है उसका proper treatment चलेगा तो धीरे धीरे वो definitely कम होगा. In the meantime, you can discuss that with your doctor. तो प्लेन एंटीबायोटिक जेल आप लगाते हैं, उसके ऊपर से जैसे कि मैंने बोला एक सीबम कंट्रोलिंग जेल्स होते हैं, यानी जो ऑयल है हमारा वो कंट्रोल करने के लिए आजकल एडवांस्ड क्रीम फॉर्मुलेशन और जेल फॉर्मुलेशन आते हैं, वो आप लगाइए. तो ओवरऑल आपका जब मास्क के अंदर स्किन रहेगा सो वो इन्फ्लेम्ड इतना नहीं होगा.
All right. So quickly, what I'll do is for the audience who are watching it in Andhra, Telangana, quickly मैं मेरे मदर टंग में भी एक बार जो आपने बोला है वो उनके लिए समाप्त करती हूँ. ఆల్రెడీ పింపుల్స్ ఉన్న వాళ్ళకి మాస్క్ వేసుకుంటే అవి ఎక్కువ అయిపోయే ప్రమాదం ఉంది. అండ్ దానివల్ల వచ్చినటువంటి మార్క్స్ పోకుండా ఉంటాయి కాబట్టి డాక్టర్ అంశుల్ ఇప్పుడే ప్రిస్క్రైబ్ చేసినటువంటి కొన్ని రకాల జెల్స్ అండ్ ఫేస్ వాషెస్ యూస్ చేసి వాటి మీద కొన్ని రకాల క్రీమ్స్ మళ్ళీ మీరు వెనక్కి వెళ్ళి మేడం చెప్పిన వాటిని విని యూస్ చేస్తే కనుక ఎగ్జిస్టింగ్ ఇన్ఫెక్షన్ని కొంచెం తగ్గించుకుంటే కనుక అది హెల్ప్ఫుల్ అవుతుంది అన్నారు. I'm trying to do this for the first time on this show, ma'am. In case आपको भी अगर गुजराती में आपके audience को समझाना है, very important point, please go ahead. Let's try and reach out to as many people. And to the audience who are asking if ma'am can speak in Bengali, उनका सरनेम की वजह से बंगाली लगते हैं पर मैम बंगाली नहीं बात करते हैं. Yeah.
हाँ,
A lot of people
बंगाली
are asking in Bangalore, please. So.
ઓકે. સો માસ્ક જ્યારે પહેરતા હોય ત્યારે પહેલા ક્લેન્ઝિંગનું ધ્યાન રાખવાનું છે. સો સોપ બહુ યુઝ નથી કરવાનું. પીએચ બેલેન્સ ફેસ વોશિસ ને ક્લેન્ઝર્સ તમારા ડૉક્ટર સાથે ડિસ્કસ કરીને એ તમે યુઝ કરી શકો છો. પછી તમારી એન્ટીબાયોટિક જેલ્સ આવે, અધરવાઇઝ તમારા જે સીબમ કંટ્રોલિંગ જેલ્સ આવે કે તમારી ઓઇલ સિક્રેશનને ઓછું કરે, એનાથી તમને ઘણો ફાયદો થશે.
Great. Thank you so much, ma'am. Let's see how it connects to audience. Audience, if you can just put in your question in one जैसे पायल जी आपने आपके क्वेश्चन को ब्रेकअप करके 3-4 इसमें किया है, but I would prefer if you can put in all your queries into one question. It will help me to read it out to Dr. Anshul. Well, Akash Ravi ji पूछ रहे हैं, ma'am, please discuss about forehead acne due to dandruff. So this is something that is very important: head hygiene, hair hygiene, and then dandruff. Would you want to explain more on this, ma'am?
Absolutely. How I put it as, it is not dandruff causing your forehead acne. It is the scalp skin has these sebaceous glands, the oil glands, which are overactive. Simultaneously, your facial skin has sebaceous glands which are overactive. So it's the
Ji.
inflammation going on at both places which are manifesting at the same time. So it is flaking, dandruff, hyper activity in the scalp skin, which will attract this fungal infection and cause the dandruff. Simultaneously,
Ji.
it will be your forehead skin which will break out and cause acne. So both of the treatments have to be done simultaneously. आपका डैंड्रफ अच्छे से कंट्रोल में रखिए, एंटी डैंड्रफ शैम्पूज यूज़ करिए. बहुत ज़्यादा ऑयलिंग अवॉइड करते हैं, बट नेवरदलेस ऑयल बिल्कुल यूज़ नहीं करना है ऐसा नहीं है. यू कैन यूज़ अ शॉर्ट कॉन्टैक्ट थेरेपी. शैम्पू के 1-2 घंटा पहले आपने यूज़ किया या कोई लाइटर ऑयल यूज़ किया आपने, तो वो अच्छा रहता है. एंड
Ji.
साइमल्टेनियसली आपका नाइट क्रीम्स जो फोरहेड एक्ने पे आप लगाएंगे, ज़रूरत पड़ी तो ओरल टैबलेट्स जो आपका डैंड्रफ कंट्रोल करेगा, या ओरल टैबलेट्स जो आपका एंटीबायोटिक्स वगैरह शॉर्ट कोर्स रहेगा एक्ने कंट्रोल के लिए. सो बोथ हैव टू बी ट्रीटेड साइमल्टेनियसली.
Great. Thank you so much, because this is something that my daughter is going through as well. So I've simultaneously put her on an anti-dandruff treatment and as well as as acne treatment. Thank you. And the two questions which are related, I think I'll take up these. Saleha Parveen ji and Vaidehi, both of them. Saleha Parveen ji का मेरे पास age नहीं है, उनका दोनों का registered questions है. Saleha ji is saying that I'm having hypothyroid and other hormonal issues. Sometimes periods, I have a problem with my periods as well. How to reduce my acne? Then Vaidehi is 35-year-old. I'm diagnosed with PCOD and suddenly I have acne below my face. Any diet that I need to take care in particular?
Okay.
These are the two
So this
questions.
classical adult acne which is happening on the V area, so we called it as V zone acne instead of that T zone acne which is seen in the younger age. So adult acne, hormonal acne, commonest cause is PCOD. So even with thyroid underlying abnormalities, we have to rule out PCOD in the first name that you suggested. And
Ji.
for PCOD, you have to treat PCOD. You have to make certain lifestyle changes which will balance your hormones which will balance your weight and also which will take care of your skin metabolism. तो जब तक आपका प्राइमरी हार्मोनल बैलेंस का जो भी ट्रीटमेंट है वो नहीं आएगा, तब तक खाली एक्ने कंट्रोल नहीं हो पाएगा। तो दोनों केस में आपको थायराइड का जैसे मेडिसिन आप रेगुलर ले रहे हैं, साथ में आपका एक्सरसाइज डाइटरी चेंजेस जो है वो कर रहे हैं, उसके साथ हम आपको कुछ प्रोसीजर्स में रख सकते हैं टू मेंटेन योर स्किन। तो आपका एज के साथ जो एंटी एजिंग इफेक्ट चाहिए, एच ए बी बेस्ड जो केमिकल पील्स होते हैं वो अच्छे से काम करते हैं, तो आप रेगुलर इंटरवल्स पे कर सकते हैं। या फिर रेटिनॉल बेस्ड क्रीम्स आप अंडर में यूज़ कर सकते हैं, जिससे एक्ने भी कंट्रोल में रहेगा।
Right. So quickly, I'll sum it up for you whether he and anybody else who is going through thyroid and other PCOD issues. డాక్టర్ గారు ఏం చెప్పారంటే పీసీఓడి లాంటి ఇష్యూస్ ఉన్నప్పుడు ఫస్ట్ అండర్లైన్ అలాంటి ఇష్యూస్ని మనం హార్మోనల్ ఇష్యూస్ని ట్రీట్ చేయాల్సి ఉంటుంది. ఆ తర్వాతనే బయట కనిపిస్తున్నటువంటి యాక్నేని మనం చేయాలి. చాలా టిపికల్గా ఈ హార్మోనల్ ఇష్యూస్ ఉన్నప్పుడు యాక్నే ఈ వి జోన్లో మాత్రమే కనిపిస్తుంది, అవి పెద్ద పెద్దగా కనిపిస్తాయి. ఏజ్ రిలేటెడ్గా ఇది బయట నుంచి మీరు ఏం చేసినా సరే అవి మాత్రమే చేస్తే సరిపోదు, హార్మోనల్ ట్రీట్మెంట్ ఫస్ట్ చేసుకుంటూ వీటిని కూడా మనం చేయాల్సి ఉంటుంది. అలాగే అదర్ ట్రీట్మెంట్ ప్రొసీజర్స్ని కూడా మనం యూజ్ చేయొచ్చు. ఆ ట్రీట్మెంట్ ప్రొసీజర్స్ డెర్మటాలజిస్ట్ సమక్షంలోనే జరగాలి. I've added one word with caution, ma'am, कि ये डर्मेटोलॉजिस्ट के सलाह से ही आप ये जो प्रोसीजर्स है वो चुनिए.
बिल्कुल।
Yeah. So I'll take the next question. This is, yes, I'm going to ask, where did that question go? Okay, Pankaj Singh, I'm having very big acne on my lower back. It comes back and goes even after medication. It hurts a lot. Please guide me.
Okay, so what I understand is he's talking about cystic acne. मोटी गांठ
Acha.
होय, pus होय, and it is a lot of sometimes blood comes out, pus comes out. So then it keeps on refilling. यानी कि वो
Right.
सिस्ट जो है वो गैप स्किन में अंदर ग्लैंड के साथ पूरा एरिया इन्फ्लेमेशन रहता है, वो सिर्फ कम हो जाता है, वापस उठ जाता है। सो व्हाट वी हैव टू
Correct.
अंडरस्टैंड इज whether that cyst is completely inactive after treatment or not. But still, there are certain challenges wherein it refills again and again. For that, you have to be on maintenance treatment for quite some time, more than 6 to 10 months. Only then it
Okay.
doesn't cause those recurrences.
Right. So recurrent के बारे में मुझे जब मैं बात करती हूँ, I am going back to my lot of people are asking about recurrent acne and acne scars. If I remember my younger age, see I've stopped acne only after 30. So younger age, I used to have one or two spots where the same cyst used to grow back and then retract, grow back and retract. And it used to get inflamed with every time I used to rub it with a sponge or a brush or anything else that it was causing an external abrasion kind of thing. It used to come back. I used to suffer a lot, and it actually has left a very, 2 or 3 spots where those pimples used to appear again and again. I have a scar which is left. So this is something that I see a lot of people have, that they remain, the scars remain. How do we address this?
First of all, we don't have to touch, pick, or scratch the acne. For immediate relief, when we don't like that popping thing on the face, we try to squeeze it out. It it'll reduce the size temporarily, but then that's going to bother you with that mark for more than 3 months, even with treatment. So the first thing
I'm
to
here, ma'am.
prevent.
I'm here. For the pressure of being on screen, I always used to do वो bump अच्छा नहीं दिखता था, तो reduce करने के लिए पहले एक भले ही स्टेरलाइज नीडल हो या कुछ भी हो, उसको स्टेरलाइज करके मैं prick करती थी, and then I used to try and squeeze it out, and it never used to go. It used to fill back.
I know. So the first thing, whenever we think of scarring, we have to think of prevention of scar. क्योंकि स्किन एक बार डैमेज हो जाता है, उसको पूरी तरह हम नॉर्मल नहीं कर सकते, उसको प्रिवेंट कर
जी.
सकते। Then,
Uh,
whenever you have these active acne, it is coming back and back, you seek proper treatment so that scar formation ही ना हो। Once scar has been formed, the next best thing that you want to do is treat those recent scars as soon as possible, ASAP. Because once that scar tissue is formed, that cementing has been done, the fibrous tissue has been taking over the normal tissue. It is very hard to remove all that. अगर हम
yes.
लेजर्स करें, CO2 फ्रैक्शनल लेजर कॉमनेस्ट है, MNRF अभी एडवांस ट्रीटमेंट है, माइक्रो नीडलिंग, रेडियो फ्रीक्वेंसी. So all these procedural device based treatments will help if done with a proper guidance and with an expert hand. They give you best of results, but at the end it will still remain a little less than your normal skin. So the
Okay.
recent scars respond very well to your regular, procedural or scar-based treatments. Once the scar has been there for quite some years, then it is very difficult to give the best possible result.
हम्म. तो यहाँ पर रवि जी का मुझे क्वेश्चन दिख रहा है, मैम आई डोंट हैव करंट एक्ने बट आई हैव पिटेड और बॉक्स्ड स्कार्स, हाउ डू आई ट्रीट देम? सो अगर ये काफ़ी साल हो चुके हैं और ये पिटेड स्कार्स बन चुके हैं एंड पार्ट ऑफ आवर फेस हो जाता है, ज्योग्राफी ऑफ द फेस इज लाइक आई हैव एक्सेप्टेड माई सेल्फ विद दोज पिट्स, सो वॉट इज इट दैट आई नीड टू अप्रोच? डू आई गो एंड आस्क डर्मेटोलॉजिस्ट कि मुझे ये पील चाहिए या मुझे ये ट्रीटमेंट चाहिए, और डू आई लेट द डर्मेटोलॉजिस्ट डिसाइड वॉट इज गुड फॉर मी?
तो सी इट्स म्यूचुअल. यू हैव टू टेल अस योर एक्सपेक्टेशंस. मुझे 6 महीने में अच्छा करना है, या आप कितना भी टाइम लो, मुझे बस अच्छा होना है. सो वंस इट इज
हाँ
टाइम बाउंड, द ट्रीटमेंट अप्रोच चेंजेस. And secondly, now with the busy schedules, if we are opting for something like a chemical peel or some microneedling or derma rollers, you have to very frequently visit the dermatology clinics. So then,
जी.
if the doctor is nearby, then it is feasible. But we have patients coming from all over the country, બીજા શહેરોમાંથી આવે, બીજા સ્ટેટમાંથી આવે. So then it is not possible for all of them to commute every 2 weeks, every 3 weeks. So we have to
Correct.
plan a treatment that suits their needs and their long term compliance. जो वो फॉलो कर पाएंगे लॉन्ग टर्म तक, वही रिजल्ट देगा.
Exactly, exactly. So treatment option हमारे requirement ही नहीं, it's also about what suits the patient and their time, right?
The
So
reason is
interesting.
because
हाँ, please
your
go ahead.
dermatologist and the patient both will mutually decide. We guide you to all the basic treatment options. We guide you what will work best in your case. In case of box scars, ये वाला treatment and MNRF अच्छा use होगा. साथ में हम subcision कर सकते हैं, साथ में हम fillers कर सकते हैं. तो ये सारे treatments रहेंगे. फिर पेशेंट हमें बताते हैं उनकी रिक्वायरमेंट्स, उनके ड्रॉबैक्स, उनकी प्रॉब्लम्स, एंड देन वी कम टू अ म्यूचुअल डिसीजन कि ये ट्रीटमेंट हम इतने समय में पूरा करेंगे. बट एट द एंड ऑफ इट
Wonderful.
इट रिक्वायर्स सम पेशेंस एंड द ट्रस्ट इन योर डॉक्टर.
Great. Ravi Garu, trust your doctor. Dr. Anshul is here in Ahmedabad, but Apollo 24/7 also gives you an opportunity of meeting dermatologist who is very close by in your area as well. But in case you want to meet Dr. Anshul Warman, if you want her consultation, she is also available on Apollo 24/7, just for your information, audience. All right, here's the next question, ma'am. Umar Amjad ji पूछ रहे हैं, hello ma'am, I'm 26-year-old and I have seborrheic dermatitis. What is this, ma'am? It sounds very complex, but what is this?
Seborrheic dermatitis is a reactive inflammatory disease of the skin. Primarily, it's a sort of an eczema which
Uh-huh.
happens in areas where you have a lot of concentrations of sebaceous glands. So that means commonest would be your scalp, your face, your behind the ears, your upper chest, upper back. Commonly, it's around the nose, on the eyebrows. So, all these areas where the sebum activity is high, your skin reacts to it and causes inflammation. So, any sort of inflammation in the skin is termed as dermatitis. So, it will be in areas which are prone to seborrheic activity, and then it requires a lot of maintenance treatment.
Oh, so it's not like one day liya treatment and khatam ho gaya, once treatment. It's a lot of maintenance, as I understand. ठीक है. Ma'am, here's another question. HYYFYY Creations, इनका नाम मुझे नहीं दिया गया. 24-year-old male है. My face was clear and suddenly I've started getting hyperpigmentation and acne. So I hardly went outside. Any suggestions?
Okay, so there could be two things in this. One, in young adult males, when we see a lot of acne, sudden flare up of acne, pigmentation, what we have to understand is insulin resistance. That means अगर आपका मेटाबॉलिज्म डिस्टर्ब हो रहा है, आपका स्किन या बॉडी में इंसुलिन रेजिस्टेंस आ रहा है, जो कि हमें स्किन में कैसे दिखता है, इन एडिशन टू योर वेट गेन देयर कुड बी डार्कनेस in the neck area, in the body fold area, in the underarms. There will be a lot of pigmentation here on the forehead. So all that
This
is
area.
a manifestation of, yes, the sides. So that is all part of your insulin resistance. Plus, if you're
Hmm.
a person who is, and I wouldn't say just a software professional, but anybody nowadays, a lot of mobile usage, a lot of laptop screen usage, wherein you're not using an IR filter, you're not using any sunscreen which is blocking the infrared effect on the skin, then this causes such a pigmentation. Simultaneously, it could be the acne, which is also a manifestation or a symptom of your insulin resistance. So, if you're gaining weight, if you have a sedentary lifestyle, then first of all, we'll have to rule out that.
Right, right, ma'am. Ma'am, while you've been answering this, I was looking at a few questions down here. Mr. Sesharao Malla Pragada is asking this question. He underwent a surgery apparently, and after radiation, my pituitary. I'm sorry. After surgery and radiation, my pituitary gland, for I suppose it is for his pituitary gland. I'm using Sustanon 100 mg once a month. Mm, I lost his question, but as Mr. Seshrao's question was that he is using certain medications, and now his testosterone injections के बाद उनका acne बढ़ गया है. Does testosterone also cause acne, ma'am?
Yes, it does. That is the primary hormone which gets converted into the androgens in your skin. So your keratinocytes and this the pilosebaceous unit, that is the sebaceous gland, they will convert the circulating testosterone into androgens and DHT. That is how we put it. So that causes the flare up of acne. तो कई दवाइयों की वजह से
Hmm.
ऐसा होता है, कई बार उनके हार्मोनल चेंजेस की वजह से ऐसा होता है. So a lot of medicine, suddenly you have taken a B12 tablets, you have taken steroid tablets, you've applied a lot of steroid creams for glow over the counter, which I must request everybody not to use it. Such drugs or such medicines can also cause acne.
All right. So ये जो testosterone के बारे में हम बात करते हैं, this is not just a male hormone. This is also present in women, as I understand. तो women में कौन से
Yes.
condition में ये बढ़ जाता है, and men में कैसे ये बढ़ता है? ये androgenic जो बोला जाता है, तो वो women में कैसे present होता है? How does it? How do we reduce it?
सो अगेन पीसीओडी में भी या बाकी हार्मोनल प्रॉब्लम्स जब होते हैं, पीरियड साइकिल्स डिस्टर्ब होते हैं, तो ओवरीज में ये हार्मोन्स बनते हैं, तो उसमें आपका एक लो प्रपोर्शन में रहता है एंड्रोजन्स. लेकिन जब बाकी के आपके हार्मोन्स जो हैं वो डिस्टर्ब होते हैं, तो एंड्रोजन का एक्टिविटी बढ़ जाता है. तो मोस्ट ऑफ द टाइम्स आपका ब्लड लेवल्स हार्मोन्स का सब नॉर्मल रहेगा, सिर्फ पीरियोडिकली वो चेंज होगा, या फिर
जी.
आपका स्किन सेंसिटिविटी उस हार्मोन के प्रति चेंज हो जाएगा. क्योंकि आपके सेबेशियस ग्लैंड्स में जो एंजाइम्स रहते हैं जो हार्मोन सर्कुलेटिंग हार्मोन को एक्टिव एंड्रोजन में कन्वर्ट करते हैं, वो बढ़ जाता है. सो इन जनरल, इन सिंपलर टर्म्स, आपका स्किन सेंसिटिविटी एंड्रोजन्स के प्रति बढ़ जाता है.
G, G. All right, here's next question, ma'am. The two questions, in fact, three questions that you would want to ask something similar. पहला मैं स्मिता मिश्रा जी का क्वेश्चन लेना चाहती हूँ. Ma'am, I have an acne problem and acne is so painful. When it starts, I have two or three acne or the pustules, the bumps which come and they join, and one acne after another, it becomes tight and it stays like that for months. So इनका वो problem है.
तो अगर वो एक ही जगह पर बार बार होता है, तो फिर जैसा हमने बोला कि एक अंडरलाइन कुछ सिस्ट रहेगा, तो कई बार हमें उसमें इंजेक्शन देना पड़ता है, या ओरल टैबलेट्स उस सिस्ट को ब्लॉक पूरा तरह से डिसॉल्व करने के लिए एटलीस्ट 8 to 10 months तक देना पड़ता है. बट अगर वो नई नई जगह पर आ रहा है, सो देन वी हैव टू रूल आउट सम हार्मोनल इशू एज वेल.
Yes, yes. ठीक है. And then this is Dr. Anjana Singh and her daughter who's 12 year only. उनका भी काफी सारा acne on face है. What should I do?
सो जनरली मेनार्की रिलेटेड या प्यूबर्टी रिलेटेड जो एक्ने आता है एडोलेसेंट गर्ल्स में, it's new to them, they don't like it on the face, and we cannot give a lot of high dose oral tablets. I don't like to give a lot of antibiotics to these young girls. So then there is a major role of counseling. You have to counsel the parents as well as the young teenager, that how normal it is and how to take care of your skin hygiene. As I mentioned, pH balanced face washes work better than normal soaps. देन योर डेली मॉइस्चराइजिंग रूटीन, बहुत ज़्यादा ऑयली नहीं यूज़ करना है हमें, लेकिन एक सीबम रेगुलेटर ज़रूर यूज़ करना है. So that can go a
जी.
long way in skincare, and then agents like benzoyl peroxide or adapalene work well.
Okay, so quickly, a lot of people who are watching जो पूछ रहे हैं कि लेज़र के बाद जो पिंपल्स की तरह रेड बम्प्स होते हैं, जो किसी ने लेज़र हेयर रिमूवल करवाया है, यू नो, लॉट ऑफ अस गो थ्रू दिस प्रॉब्लम्स कि कुछ प्रोसीजर करवाया उसके बाद में रेड बम्प्स आ गए, तो उनको कैसे टैकल करें?
वो जनरली एक्ने नहीं होता है, वो फॉलिकुलाइटिस होता है. तो वो फॉलिकुलाइटिस स्टेराइल फॉलिकुलाइटिस है, यानी कि सिर्फ वो रिएक्शन आ रहा है स्किन पे जब लेज़र हेयर रिमूवल अगर अच्छे से नहीं हुआ है, या कोई और प्रोसीजर की वजह से वो सारे रेड बम्प्स आए हैं. सो देन इट्स अ ट्रांजिएंट फेज. जस्ट सपोर्टिव ट्रीटमेंट हम उसको एक 10 डेज का या 15 डेज का देते हैं तो वो चला जाता है, अनलेस यू मेस विद इट. अगर आपने उसको वापस स्क्रब करने की कोशिश की, अगर आपने उसको बहुत ज़्यादा ओवर मॉइस्चराइज करने की कोशिश की, तो कई बार सेकेंडरी बैक्टीरियल इन्फेक्शन हो सकता है, या फिर माइल्ड, कई बार जो नॉर्मल फ्लोरा होता है हमारे बॉडी फंगस का, पिटीरियोस्पोरम, उसका फॉलिकुलाइटिस भी हो सकता है. सो ऑल दैट हैज़ टू बी
Okay.
रूल्ड आउट इफ इट गोज ऑन.
जी. सो नाउ आई थिंक दैट वाज प्रज्वला's क्वेश्चन. प्रज्वला, आपका आंसर मिल गया होगा शायद. तो क्विकली लेट मी पुट इट इन తెలుగు as well. ఏదైనా ట్రీట్మెంట్స్ చేయించుకున్న తర్వాత లేజర్ హెయిర్ రిమూవల్ కానివ్వండి, లేదా మిగతా ఏమైనా ట్రీట్మెంట్స్ చేయించుకున్న తర్వాత వచ్చి చిన్న చిన్న రెడ్ ర్యాషెస్ లాంటివి, వాటిని అలాగే వదిలేసేయండి. కొన్నాటికి ఆ ఫాలిక్యులర్ రెడ్ కలర్లో ఉన్నది తగ్గిపోవచ్చు, లేదా డెర్మటాలజిస్ట్ని కన్సల్ట్ చేయండి. అంతేగాని మళ్ళీ స్క్రబ్లు చేయడం వాటి కోసం ఏమీ చేయొద్దు ప్రత్యేకంగా అని చెప్పారు డాక్టర్ గారు. Yeah. So that was Prajula's question. Now I wanted to ask about acne and scarring. There's so many people who are asking. Sushmita Samantha is asking dark spots after acne, and also generally dark spots. Then where's the other dark spots and acne? Yes, Sheetal Yadav, how can I get relief from acne spots? Yes, there are a lot of people who are asking about these dark spots and acne spots. Both of these are different, no, ma'am?
uh, Both of them are the same. If the dark spots are happening after the acne has healed, it is part of the pigmentation. That is what we call as post-inflammatory pigmentation. Now,
Ji.
then if that is too aggressive, it would leave a scar because it will damage the skin tissue completely. So it's a severe form, then it's a scar. If it's just a transient temporary phase of a few weeks wherein the skin is trying to settle on its own, it's a pigmentation or a spot. In both
Hmm.
cases, you have treated your active acne well, the residual complications or the after complications will be minimum. So the first thing is, nip in the bud. आप पहली स्टेज में ही उसको एक्टिव एक्ने में ही उसको कंट्रोल कीजिए, तो आपको ये सारी तकलीफ जो इतने लंबे समय तक चलती हैं उसको फेस नहीं करना पड़ेगा. The second thing
Ah.
is, for pigmentation, that is the spots, we can use simple, creams under prescription like vitamin C based or azelaic acid based creams, which work well. For the scars, just creams and tablets do not work. We have to take some procedural help. Microneedling, subcision, there are a lot of treatments available, lasers.
Gee. So, Aravi Mozatsoni, I think your question is answered there. She is also suffering from post acne spots. Sometimes they even look like black moles. So, these I think home remedies ke saath nahi ho sakte. I think Arvi requires some kind of procedural help, no ma'am?
Yes, yes. The spots will require some prescription-based treatments in creams and all, and plus some procedure. Spots can be treated with creams, but the scars cannot
Hmm.
be treated just with creams alone.
Right, right. So here's Mr. Vimi Gandhi, Miss Vimi Gandhi, 46-year-old female. She had ulcerative colitis and had multiple surgeries and a lot of steroids, due to which skin has become very thin and has developed dark patches. So, any treatments from dermatology and ma'am?
We have to give a lot of moisturizing. If she is not been using topical steroids, if it is oral steroid, that means tablets के फॉर्म में ही लिया है, तो स्किन हम अच्छे से ओरल आइसोट्रेटिनोइन या ओरल कैरोटिनॉइड्स के साथ इम्प्रूव कर सकते हैं. साथ में हमको माइल्ड फॉर्म्स ऑफ एंटी एजिंग या जो स्किन रिपेयर ट्रीटमेंट्स होते हैं एएचए वगैरह, वो एक माइल्डर फॉर्म में मेंटेनेंस में देने पड़ेंगे. आई थिंक दैट शुड हेल्प.
Right. Now I see a lot of questions from 13, 14, 18, Ritika, Suman, and Sonia Sundaram. All these are young children, young either children or children's parents who are asking these questions. Yes, we have discussed quite a bit. You can go a little earlier and check. Dr. Anshul has already spoken about teenage and how do you address them. But here's one important factor that I want you to reiterate on, Dr. Anshul. Sonia is asking, she's 13-year-old, has a spot or acne, whatever you call it, on the forehead. It does not look good, and I get teased a lot because of this. Yes, this is a huge peer pressure. We are living in a world where everybody wants to look good, blemish free, spot free, acne free. What kind of pressure are we putting on our children? On our, we are also adding pressure onto children. Not just children, everybody. In fact. Would you want to add here, ma'am?
Uh, well, definitely there is a lot of peer pressure. There is a lot of social media pressure, wherein you want to look flawless all the time, and that's just not possible. But what we can do is we can, you know, cut down on the healing time. So with medical help, with if you're seeking proper dermatologist advice, they would give you a temporary camouflage. That is, it will cover up the spot temporarily so that her confidence is back. The first thing that we want, and simultaneously the counseling part, then the medical treatment in forms of creams. If it's a bad scar, I know it would take at least 6 months to settle. Then even if at 13, generally we don't do any procedures. I would like to wait. But if it is just a single spot and it's causing a lot of anxiety, I would want to do a minor spot peel on just that area.
Right. So yes, Pratima Chatterjee, sorry, Paramita Chatterjee के question के साथ मैं live questions बंद करना चाहती हूँ. What type of treatment do you suggest for acne at the age of 35 to 40 years? अब तक तो हम बच्चों के बारे में बात कर रहे थे, तो अभी adults के बारे में बात करेंगे.
ओके. एडल्ट्स में ये जो एडल्ट एक्ने में मोस्टली, जैसे हमने अभी भी बात की, एंड्रोजन प्लेज अ वेरी इंपॉर्टेंट रोल. तो ओरल एंटीबायोटिक्स या आइसोट्रेटिनोइन इतना वर्क नहीं करता है. साइमल्टेनियसली हमें एंटी एंड्रोजन्स टैबलेट्स के फॉर्म में देना पड़ता है. कई बार वो ओरल कॉन्ट्रासेप्टिव पिल्स हो सकता है, या फिर साथ में एक स्पाइरोनोलैक्टोन करके एक दवा आता है, वो हो सकता है. Simultaneously, topical agents also change. So we have a lot of retinol based, a lot of salicylic acid based, gels which will work better.
तो ये जो आपने नाम लिए हैं, ये इतने बार हम हर ब्यूटी प्रोडक्ट में, हर क्रीम में सुने हैं कि एवरीबडी ऑन द काउंटर, ओवर द काउंटर की ये एज के लिए है, ये एक्ने के लिए है, बेचते हैं. बट हाउ मच टू यूज़, व्हाट टू चूज़, दिस इज ऑलवेज अ क्वेश्चन. कि ये रेटिनॉल की क्रीम्स हैं, वो भी मिल जाते हैं, सैलिसिलिक के है वो भी मिल जाते हैं. हाउ डू आई ट्रस्ट एंड हाउ डू आई पिक देम, चूज देम?
No, see, with every age, with every season, your skin changes and the skin requirement changes. So, आपको पहले आपका स्किन समझना है. आपको क्या प्रोडक्ट सूट करते हैं वो समझना है. उसके लिए एक एक्सपर्ट एडवाइस या एक्सपर्ट सजेशन आप लेते हैं तो वो बेस्ट होता है. So once you discuss with your dermatologist, my routine is so and so. I am on the screen for so much time. I am on the in front of the camera for so much time. I am behind the mask for so much time. This is my daily schedule, and I want a skincare regime. So that is the best way to do it. If you want to, listen to your friends and salon advices and all, please be cautious. My first advice would be, don't trust it blindly. If at all you want to try it, at your own risk, don't use it for the full face ever. Do a spot peel for a spot patch testing for 2 3 days, and then only decide for yourself.
Super. Thank you so much. So, sun exposure and pimples and tan. Yes, This is a huge issue. So I would want you to give us top tip now. सुबह आनंद जी भी पूछ रहे हैं उनके बच्चों के लिए something which is important for everybody of us, all age groups. I want you to give us top tips wherein, what are the top 3 causes that we are increasing our acne and top 3 tips to reduce our acne. Top tips time from Dr. Anshul Warman.
Okay. So, my first tip would be, if you have an acne flare up or an acne breakout, don't stress. The second would be, don't pick on your acne ever. The third would be, seek expert advice, even if it is for a small 2-3 breakouts, but it is happening again and again. It is best you see a dermatologist. Then next would be, you have to plan ahead. If you're having active acne at the moment and just 1 or 2 are leaving some scars, you have to understand that if you want to have a scar preventive treatment, you have to plan ahead. The next would be, avoid self medication, especially the oral tablets. You cannot stop and start your isotretinoin or your antibiotics just as your own wish. The next would be, understand your skin and how your body and your health reacts to certain situations like your stress or your dietary changes, your sleeping pattern, your period cycle. So you have to give some time to your skin to understand how it behaves.
Wonderful. Thank you so much, Dr. Anshul. You have given us confidence in taking care of our acne कि इनको completely हम दूर नहीं रख सकते, पर आते हैं तो कैसे treat कर सकते हैं and कैसे manage कर सकते हैं. That was a wonderful session with you this Sunday morning. Thank you so much.
Thank you. Thanks, viewers.
Yes, and that's Dr. Anshul Warman who is with us. And now it's your time. आपका time है questions answer करने के लिए. और you also win prizes from Apollo 24/7 if you participate in this quiz session. Here I'm going to ask you 3 questions. You have to type your answers on YouTube chat only. Winners' names will be announced towards the end in a short while, and we shall be selecting the winners at the sole discretion of Apollo 24/7 team. Once I have taken your name as a winner, please write back with your contact details at marketing@apollo247.com and gift vouchers will be shared with you. Chaliye, questions ka time aa gaya. The questions are here on the screen. State true or false. Acne is caused by stress. Well, doctor has just told us that it aggravates by stress. True or false bata dijiye. Is acne caused by stress? Question number 2. Fill in the blank. Pustules, nodules and cysts are the types of. बस आपके टाइटल में ही है आज. आंसर्स बहुत सिंपल है. क्वेश्चन नंबर 3. वन कैन विन. कौन बनेगा करोड़पति केबीसी के घर बैठे जीतो जैकपॉट ओनली ऑन विच ऐप? You can fill the blank. Which app gives you a chance to win KBC घर बैठे जीतो jackpot? आप अगर वो शो देख रहे हो तो आपको पता चल जाएगा. ये शो देख रहे हो तो भी पता चल जाएगा. सो सिंपल है. आपके हाथ में जो ऐप है, आपके जो मीडियम है वही है, जिसमें ये शो देख रहे हो वही है क्लू. Go ahead, type your answers and you will be able to win gift vouchers from Apollo 24/7. If you win or not, here are gift vouchers for you that we are giving away. आज के लिए हम दे रहे हैं gift vouchers. First we see is one code that you can use on Apollo 24/7 where you get 150 rupees off on first online doctor consultation. So doctor consultations direct from Apollo with flat 150 rupees off. The code that you use is first we see. And the next coupon that we give away today is flat 25% off on medications on online medicine orders direct from Apollo. Use the code FIRST3 FIRST and numeral 3. You have to use this on Apollo 24/7. Download the app and use this coupon and get benefits as 25% off on medicine orders as well. And exclusively for the Health Hour viewers, this show gives you a coupon HH247. You will not find this anywhere else. So remember this coupon HH247 and get up to 199 off on online consultation with Apollo doctors and up to 20% on medicine orders. You can use this coupon in addition to the other coupons that we shared as well. So Health Hour viewers, thank you so much for joining us. Your question is not just your question, it is an answer for a lot of people who are watching this show who would not ask their questions in person. So thank you. Keep joining us every Sunday because we get an expert every Sunday to this show. Sunday morning 11 to 12 we are here with Apollo experts, and next Sunday you have to join us because it's a very very interesting topic. What are the best diets for weight loss? फैट डाइट है या सच्ची में काम करने वाला डाइट है? इतने सारे डाइट्स आते हैं, सीजनली डाइट्स चेंज होते रहते हैं. द बैंड वैगन ऑफ डाइट्स is huge. So I might have jumped on to a few, I might have got down a few. You must be trying out a few right now, and then you must have tried a few earlier. What works for you? What are the best diets for weight loss? Let's talk everything about it next Sunday, that is 28th August, 11 a.m. If you do not want to miss this show, please do subscribe Apollo 24/7 YouTube channel, or you can follow us on the socials. And also, if you want a notification, do subscribe, and then you'll a notification alert on kar dijiye, then you will have an alert on your email or your mobile. So we'll see you on the next week. And the I'm waiting for the winners. I have one winner's name here, Jolly Singh. Then the others, let me see if I can find. Congratulations, Jolly Singh, you are declared as one of the winner. And the others, let's see. Ishita Chakravarti and Ismail Akhtar. Congratulations. I repeat all the three winners, Jolly Singh, Ishita Chakravarti and Ismail Akhtar. Please write back to us at marketing@apollo247.com with all your contact details and claim your prizes. Chaliye, thank you all of you for joining us today. Next week milte hain. Namaskar.